Good evening and welcome to another edition of the Yuba Sutter Medical Explorer. My name is Dr. Robert Peppercorn and my specialty is dermatology. I serve as host of this program. The purpose of the Medical Explorer is to explore the medical communities of Yuba and Sutter counties and to take you behind the scenes of medical care practices in our local area. We have a very interesting program for you tonight as we explore the behind the scenes of one of our area's most popular local pharmacies. Our Channel 5 cameras will show you the multifaceted work of two Marysville pharmacists as they counsel and advise their customers about everyday health situations. I'm certain that you'll find tonight's program to be quite helpful the next time that you get a prescription from your doctor, and I hope that you'll stay with us for the next half hour. Before getting to our topic tonight, let's take a look at the latest medical news. A non-surgical fertilization technique has been used to achieve the world's first two pregnancies resulting from the transfer of an embryo from the body of one woman to another. One baby is due in about 4 months. The other woman is in her 5th week of pregnancy, reported doctors at the UCLA Medical Center. In the technique reported in a recent issue of Lancet, the British Medical Journal, a fertile woman is artificially inseminated with sperm. After about 5 days, the embryo is removed non-surgically by washing the womb with a solution and is implanted in the infertile woman. Embryo transfer is particularly applicable for women with surgically inaccessible ovaries, blocked fallopian tubes, or genetic reasons for not wanting to use their own eggs. The doctors report that preliminary evidence indicates the success rate of embryo transfer may be higher than test tube fertilization. In my next medical news story, a new anti-herpes medicine is ready for testing. Penwalt Corporation of Philadelphia filed an application with the Food and Drug Administration to begin testing a drug on humans suffering from genital herpes. As many as 20 million Americans, or nearly 1 in every 10, suffer from herpes simplex type 2, which is transmitted by contact with infected areas of the skin. It is estimated that between 300,000 and 500,000 new cases occur each year. The firm has effectively treated laboratory animals with genital lesions and blisters similar to those caused by the herpes 2 virus. The company spokesman stated that he doesn't know if the drug, a compound called somantidine hydrochloride, will cure herpes because the disease has such a long remission period. The test will be limited to topical applications, but the company may apply to test it internally later. Researchers aren't sure how the drug works, but say it's more efficient and has fewer side effects than current anti-herpes treatment. My final news item tonight concerns interferon. The highly touted but as yet unproven anti-cancer drug, interferon, has helped relieve the symptoms of a type of intestinal cancer. Reported in a recent New England Journal of Medicine, the study found that interferon reduced diarrhea, stomach pain, asthma, and skin rashes in 6 of 9 people with a rare form of intestinal cancer called carcinoid syndrome. The drug did not, however, shrink the size of the cancers or halt its spread. My health tip for tonight concerns acne in adults. Did you know that almost 25% of patients who suffer from annoying pimples or acne are over the age of 25, and that most of these patients are women? Well, it's true, and the causes are usually makeup products and moisturizers. These greasy, oil-containing products seem to damage the skin of many adult women by possibly plugging up pores in their skin. The best way to improve your complexion in adult-type acne is to avoid oil-containing moisturizers and makeups. There are many oil-free products on the market that can and should be used instead of regular makeups and creams. Some brand-name oil-free makeups that are highly recommended by dermatologists include Physicians Formula, Aller Cream, Almay Oil, and Almay Oil Free. There are also excellent oil-free moisturizing products. Some of these products include Purpose Cream and Kerry Light Lotion. If you would like to give these products a try, ask your pharmacist to order one of them for you. Now, on with the Medical Explorer. We're all faced with the need to occasionally take a doctor's prescription into a pharmacy and have it filled. Have you ever wondered what really goes on behind your favorite drugstore counter? Let's travel over to D Street in Marysville and visit one of our area's most popular pharmacies. Well, after I left the studio, I decided to stop off at my doctor, and he gave me this prescription. Well, I thought, why not take it to Pioneer Payless Pharmacy? We're going to go in there right now and see exactly what a pharmacist does. So follow me into Pioneer Payless. I'm standing now with Bob Church, who's pharmacist from Pioneer Payless. You've been here about 7 years, is
That's
that
right?
Well, we're finally going to get a good look at what it's like to be a pharmacist today. People often wonder what really goes on behind this counter and behind the counter there.
That's right.
Today's our chance. I don't want to hold up your customers. This lady's been standing here for a minute, and I don't think it's right to hold her up, so I'll just step back and let her do what she needs to do.
Okay, fine.
Hi, Bob. Just
Hi,
turn around.
Nancy.
I have some prescriptions for my mom.
Sure, I'll get her for you just
Okay.
a second. Karen, Nancy wants to talk to you.
Hi. Hi. I have my mom in the car, and we've just been to her doctor, and he gave us quite a few prescriptions, and I'm sort of confused on how to give them to her, tell her how to take them.
Oh, okay. Well, let's see what we have here. Okay, she's getting some Tegamet. That's to reduce the amount of acid that's produced by the stomach. And she's supposed to take one of them 3 times a day with meals, and then one at bedtime. Also some Carafate, 1 gram. And that, with the acid in your stomach that is there, creates a coating over the ulcer site and protects the ulcer from the acid and the pepsin and the bile that's in your stomach during digestion. So she should take that at least a half an hour, preferably an hour, before her meals.
Okay.
And the Tegamet is with the meal.
Okay.
And then he's got some Amphagel for her that's an antacid. And he's got 2 tablespoons 1 hour after meals and as needed. The antacid neutralizes the acid in the stomach. And since the Carafate requires acid to be effective, you want to make sure that there's at least a half an hour to an hour interval between the antacid and the Carafate.
Okay.
The same thing goes with the Tegamet. So I'd suggest that she takes first her Carafate an hour before the meal, the Tegamet with the meal, then an hour after the meal, take the antacid. And then if she needs the antacid during the day, just make sure that she spaces it out.
Okay. Tell me about side effects on any of these.
Okay. The Tegamet, they're very few, very rare. But if she should get them, she might have a little diarrhea, a little dizziness, a little drowsiness, might have a rash. But those are very rare. It's like 1%. In an older person, there is a possibility of some mental confusion. So, you know,
You watch
her.
Okay.
Yeah, very most definitely. Does she smoke?
Off and on.
Okay.
Not too much.
All right. They found that smoking decreases the effectiveness of the Tegamet on the nighttime acid secretion. So she should at least try and cut out the smoking in the evening.
Eliminate that. Okay, super. And I will come back and pick them up later.
Sure. Take about 15 minutes.
Okay, thanks.
See you later. Thanks, Nancy.
Well, that sure was interesting watching your wife discuss with the patient about side effects of medications and explaining different aspects about medications. I understand that is a major part of the work of a pharmacist. What have you been actually doing here? I see you're working on some other prescriptions as well.
Well, here I was just finishing up counting some tablets for one customer, but there's something interesting here that you might want to see. This morning I took 2 prescriptions for an Alice Smith from an ear, nose, and throat specialist. Apparently she has some dizziness and nausea. And I was going to fill these prescriptions, but I've noticed that we might have a potential problem here. This lady is also taking quite a heavy dose continually of Librium, which is going to add significantly to the drowsiness which she's going to experience from the Compazine.
Now, Librium is a tranquilizer.
It's a tranquilizer, right.
And Compazine is?
It's a tranquilizer, but used mainly for nausea.
For upset stomach problems. I see.
So I thought I ought to call the doctor who called in the prescriptions and make him aware of the
better get going on that. That's right.
Hi, this is Bob at Pioneer Payless. Is it possible to talk to Dr. Jones if he's not busy right now? Thank you. Hi, Doctor. This is Bob at Pioneer Payless. I was getting ready to fill those prescriptions for Alice Smith that you called in this morning, and I noticed that she takes a quite heavy dose of Librium. She's getting 25 milligrams 4 times a day from Dr. Smith, and I did not know if you were aware of that. I thought maybe you might want to have her discontinue the Librium while she's taking the Compazine and Antivert. Yeah, that's right. You know, the Compazine you said 3 times a day. Okay, sure. I'll just tell her to drop off the Librium while she's taking the Compazine, and then she'll check with you when she's done with this, okay? Fine. Thanks a lot. Bye-bye.
So by your knowing your customers, and we call them patients, I'm not sure if client or customer is the right word, you're able to know what they're taking from many different doctors. You keep a record for each person, and you can see?
Yeah, we keep a drug profile sheet on each person. That way we can look back real quickly and see what they're taking, not only from the doctor who is currently treating them, but from other doctors too, or dentists for that matter.
That's fantastic. What are some other things besides drowsiness that could be a problem when 2 drugs are mixed together?
Well, some of the things that can happen, we could see probably some drugs maybe causing some convulsive disorders if the levels were high.
You mean like seizures?
Right, seizure types of things. We see people who are taking drugs which interact maybe like an anticoagulant to thin the blood, and some drugs alter those types of drugs very drastically.
Could make somebody start to bleed when they didn't want to.
Yes, after an operation probably, that type of thing.
Right.
We see some drugs that combine that could raise blood pressure, which we wouldn't want to do.
Right. Now I noticed there's a man down here in your store asking for your attention. We better head down there and see what's going on.
I think we should, yes. Hi, can I help you?
Yeah, yesterday I scratched my elbow up, and I went to my doctor this morning, and he said, recommended I come down here and get some first aid supplies.
Okay, could I look at that just a little bit? Okay. Yeah, it doesn't look very bad. I think what we'll do is, first of all, you ought to keep it clean with warm water and a mild soap, and just pat dry it, don't rub it so you braid it. Then I think we'll get you some antibiotic ointment you can put on there 2-3 times a day, and we have a little Steri-Pad here. These are little 3x3s, and you can just put that over the over that site there. To hold it on, just some tape. Have you ever used adhesive tapes or had any problem with them?
Yeah, when I used it last time, my skin was breaking out a little bit and was itchy.
Okay, you had a rash.
Yeah.
Okay. Well, we can use what they call micropore tape. It's hypoallergenic and it won't create a problem with your skin. Then all you have to do is change that probably 3-4 times a day and keep it clean. Probably be all you have to do.
Yeah, that sounds pretty good. I heard from my friends too, they said hydrogen peroxide. They said they used that on different scrapes before they've had.
Sure, that's a very good product to use. It's antibacterial. It'll keep it clean and sterile. And I have a bottle of that here. And you could apply that, just pour some on your gauze pad and put it on there first, and then use another gauze pad to cover it after it's dry. Okay?
Okay.
All right, fine. The lady, you'll probably need a few more of those to get you going. And the lady at the register will get you the ointment. That'll take care of you.
Okay, thank you.
Thanks a lot. Bye-bye.
The staff of the Pioneer Payless Pharmacy did a great job demonstrating some of the responsibilities and tasks of pharmacy work. Let's meet again with 2 of the pharmacists from Pioneer Payless. My guests tonight are Bob Church.
Hi, how are you?
Thanks for being here.
Thank you.
And his wife, Karen Church.
Hi.
They're both registered pharmacists, and welcome again to the Medical Explorer. Bob, could you begin by telling our audience about the training that one must go through to become a pharmacist?
Certainly. The training in California now is broken down into really 2 phases. The first part being 1 to 2 years of pre-pharmacy courses, which are your basic science courses and your liberal arts courses. And then you transfer into a professional school of pharmacy, which is at the same physical site. Those courses then are for a 3-year period, usually an intensive course of 11 months per year for 3 years. And that's where you really learn about the drugs and physiology and anatomy and how medications work.
And Karen, did you train at the same place?
Yes, we both went to the